This meeting is being recorded.
Welcome, everybody. Hello. Thank you so much for joining us today. Happy Friday to everybody. You are here because you are very interested in talking about creating your own community, understanding your role in decision-making, which is what we're here to talk about today. This self-advocacy training will focus on a new home and community-based services, or HCBS settings rule, that empowers advocates to make their own decisions in their community. My name is Donna Meltzer, and I'm the CEO of the National Association of Councils on Developmental Disabilities, or NACDD. NACDD is the National Association for the 56 Councils on Developmental Disabilities, or sometimes we're called DD Councils for short, and we are across the United States and the territories. I'm so pleased today to join with our longtime partner, Autism Society of America, Kim Mushino and Chris Banks. I want to thank you both for welcoming us as your partner in this training session. So today we are going to bring you new information, hopefully empower more self-advocates and family members to understand this new rule and make a plan to exercise your rights under the new HCBS settings rule. Self-advocates fought for years to get the government to make this rule. The HCBS settings rule reaffirms that people with disabilities and older adults receiving Medicaid, home and community-based services, receiving Medicaid services have the right to community life, including access to the broader community, control over your daily lives and opportunities for employment. We're holding this webinar now because the rule is finally going to be taking effect in just a few months, and we want to make sure that you are prepared. So in the next 90 minutes or so, we will explain this new HCBS settings rule in plain language, so you can use it as a tool to have discussions with your provider or case manager, your support team, your family, about the community you want to live in. We will also hear from self-advocates about the importance of person-centered planning and how to express and get what you want from providers and your family so you can live the best life that you want. Finally, we'll break into some smaller groups so that you can work on an action plan to develop your own plan for creating the community you want to live in. Again, I want to thank you for joining with us today. I hope you will learn a lot and will fully participate. Now it is my pleasure to introduce Kate Brady from the Human Services Research Institute, or HSRI. Kate will speak with us about the rights guaranteed to all people receiving services, Medicaid support services under the HCBS settings rule. Kate, thank you so much for being with us today. I turn it over to you.
Thank you, Donna, and thank you to everyone who's here to learn about the home and community-based settings rule, which really is tremendously important in our everyday lives. So before we talk about the very key rights that the home and community-based settings rule affords us, I want to be sure we are thinking of the same thing when we think about home and community-based services. These are services that provide support or help for employment, transportation, home health, like housekeeping, or in-home therapies like physical therapy or occupational therapy, or help with activities of daily living like getting dressed every day, getting in the shower, going to the bathroom, cooking, and then other things like assistive technology and modification of your home. And there are in 2018, so there's more now. In 2018, there were more than 4.7 million people. So we have 36 people on today, and all of you probably have thoughts and things to say about the supports that you receive. And HCBS services are Medicaid funded, meaning they're federally and state funded supports. And every state provides the supports differently, which is why it's so important to be clear about what rights the settings rule gives you. So I'm going to go through some key rights. The first is privacy, meaning you should, wherever you live, be allowed to be in your own bedroom by yourself if you want, or go somewhere else in the house to get away from other people. You also should be allowed to have visitors in that space and have privacy with your visitors in that space. The rule also affords us the right to dignity. And really simply, dignity just means that you should, in your everyday life and with the services that you're getting and the help that you're getting from the people around you, you should be allowed to feel good about yourself and be treated like you're worth something. Another really important right afforded by the HCBS settings rule is the freedom from coercion, meaning that the people supporting you and other people in your life should not be making you do things that you don't want to do. The next one is freedom from restraint. And freedom from restraint is probably the most complicated of the rights that this rule gives you, because unfortunately, people with disabilities experience being restrained in lots of different ways. It can be really simple, like somebody holding you to keep you from doing something. It can be having somebody put something on your wrist, like restraints, or tying your arms down, or making you stay in bed and using restraints that keep you in bed, or something to cover your hands. It can also be being locked in a room, not being allowed to get out, or not being allowed to get food, and being punished, right? So restraint is usually about being punished. And people in HCBS services are everyday citizens. Nothing about your supports should involve being in trouble or being punished. Another example of restraint is using alarms to make you stay in bed or stay in your house. And the last way that we know that sometimes people experience restraint is that they're given medicine to control their actions. So maybe too much medicine to make you sleepy, or not care about stuff, and that isn't allowed either. Respect, much like dignity, is a right that you have within your services. And that just means treating other people with kindness and consideration. And that means that you should expect to be treated with kindness and consideration, and that you should expect to treat others in that way as well. And it also means being allowed to speak up. And that's what we're going to talk about today, being able to speak up about what you need and want. So you'll notice that the home and community-based service settings rule says settings, meaning we are interested in where do the supports that you get happen? And do you have full access to the greater community? So that means that you should have choice about where you live, where you work, where your job is, if you go to a day program, if instead you want to do things with people without disabilities and be able to go to the coffee shop or the movies. And the other right is choosing from non-disability specific options, right? So that means spending your time with people with and without disabilities. The rule also requires that you have a person-centered plan, and that what they call your individual initiative is optimized. And that just means that you're supported to live your life the way that you want. So what you do, having control over your schedule, having control over your money, and choosing who provides your help, as well as what help you get. And those are the main rights afforded to you by the HCBS settings rule. They are easier to describe than they are to make happen. So I'm going to turn it over to Emmanuel so that we can talk more about this. Thanks.
Thank you, Kate, for that very quick overview. And welcome everyone to our self-advocacy-led panel about the new home and community-based services ruling. As Kate mentioned, the rule has more than 4 main points, but today we are here to talk about those, but primarily talking about ensuring that you as an individual are involved in those decisions and making sure that you have the power to ensure that you receive the services that you want, that you are not coerced into doing things that you don't want to do, that you are able to have visitors, and much, much more. So I'm Emmanuel Jenkins. I am the Community Relations Officer for the Delaware Developmental Disabilities Council. And I've had the pleasure of being your moderator today with some amazing panel members. Kate has already been introduced, but Kate has a really big job that she does really well, working for, I want to make sure I say this properly, Human Services Resource Institute. Again, welcome, Kate. And we got Liz Weintraub, a leader in the self-advocacy movement, and the host of Tuesdays with Liz. Liz is also a full-time staff member for AUCD, which is the Association of Universities Centers for Disabilities. And then we have, give me 1 second. I'm using a screen reader, so I do apologize, but give me 1 sec. We have Derek Spahn. Derek was diagnosed with autism in 2014. Derek graduated from Old Dominion University in December of 2020 with a double major in Spanish and English. Sorry, I'm butchering Derek, I apologize. Give me 1 second. My screen reader has frozen. Speaking of assistive technology. Give me 1 moment.
You want me to help out, Emmanuel?
Oh, hold on 1 second. I'm sorry. Now it won't stop reading. So with that, with Derek's double major, he had an emphasis on English and creative writing. Derek joined the board of Autism Society, where he can continue his work in advocating for those with autism. So again, welcome to all the panel members, and we will jump right into our questions. My first question is for Liz Weintraub. Liz, can you tell us a little bit about your community living situation and how it is important for you to be able to make decisions?
Thanks, Manuel, and I'm really excited to be here today. So thank you, NACDD, as well the Autism Society of America for inviting me. Community means to me freedom and that I can walk around around the community just like anyone else. I know what community means. I know what community means and what it's not. Because when I used to live in a I used to live in an institution and they called it the community. They called it the community, and that's how they got my parents to say that I should go. And it's not the kind of community I live in today, where I can shop and eat and be part of the community. So that's a little bit about what community means.
Thank you, Liz, so much. My next question is for Derek. Derek, what services do you receive?
Hi, thank you. I'm currently receiving case management with the city of Chesapeake, and I have a housing guide because I'm working on moving into my first apartment, and I also I'm temporarily getting recreational and occupational therapy.
Thank you, Derek, and congratulations for working on moving into your own apartment or house. So congratulations on that.
Thank you.
My next question is for Kate. Kate, why is the HCBS setting rules so important?
Thanks, Emmanuel. It's so important because it affects all of our everyday lives. It affects all the people with disabilities and older Americans we know get services, and all the people in their lives and their neighbors and their coworkers, because it says finally that services must uphold those rights that we talked about, and that they must make our lives better, and they must be the ones that we choose. They must be the services that we choose. So that's why it's so important. It's taken so long for it to happen. It's been more than 8 years we've been in what we call the transition process, because it's a huge, complicated system. And like we said, states have choice in how they administer services, and there is money to be made in serving people in segregated settings and not providing choice. So it has taken us time to move the system, and finally we are coming up on the deadline. So we'll see that there will be a requirement that states are in compliance in March 17th of 2023.
Thank you so much for that. And to Liz, as Kate just mentioned, this ruling has took quite some time, but you've been fighting to see this rule really come to reality. Why do you think a ruling had to be put in place for this to really come to fruition for people with disabilities there? And that question is for Liz.
And thank you, Emmanuel, for asking that question, because yes, it has been a long time, and I'm really excited to not only be here, but to see that this is going to be a reality. In March, it's going to really be here. Because unfortunately some people, such as provider families, don't often see us as people who can decide what we want in our life. People see us as children. People see us as that we're not able to make a decision. If I make the wrong decision, who is anyone to tell me that I'm making the wrong decision? I'm an adult. I'm over 50 years old. I think that's an adult. And why am I treated like a kid?
Thank you so much, Liz.
You're welcome.
My next question is for Derek. Derek, are you excited about the new settings rule?
I am, because I think it's important to have rules that help people with disabilities to get the rights they deserve set in stone. And I would say that like I used to receive in-home services, and I often had to deal with workers who were rude or showed up late and left early. And because I needed help with them getting me to appointments, and if I didn't get there on time, then I wouldn't be able to have the appointments. That was that was more than inconvenient.
Thank you so much, Derek. And you are absolutely correct. And with this new ruling, you'll have more control with people leaving early and things of that nature. So thank you for that. My very last question, before we close out this panel, is for Kate. Kate, all states have to follow this rule starting in March 17, 2023. Why is this date so important for self-advocates to remember? And what can we do to ensure that we are ready when March 17th comes around?
Thank you, Emmanuel. You can tell that I was so excited about that date that I jumped the gun and I already said it. And then Kim put it in the chat. So the date for all states to have either an approved statewide transition plan saying how they're going to come into compliance, or a corrective action plan saying what they're going to do about the places they don't think can be in compliance, is March 17th, 2023. And so what that means is that all of those basic rights should be honored everywhere that you're getting services. And the only exceptions that some states may ask for is they may ask for more time to offer everybody employment supports, and they may ask for more time to be sure that people can choose their roommates. But every other thing, privacy, dignity, respect, freedom from coercion, all of those rights should be in place. So what that means is that we need to be ready to say if it isn't. And that could be telling a friend or a family member. It could be talking to a case manager. It could be changing your services. It could be talking to your elected official, your senator, your representative, your city council person. Always speaking up if you feel like your rights are being violated. That's the biggest, most important thing. And then if you want to, you can also contact NACDD or the Autism Society, and they will help get you in touch with the right person. And remember that that person-centered plan is the pathway that you have for planning out how you want your life to go for the year. And you're entitled to that plan being completely up to you, how it goes, who's involved, how you make those decisions. I think those are the important things to remember. Thanks, Emmanuel.
Absolutely. Thank you so much. So March 17th is the most important date that I can think of so far. So if we all have, which I hope that we all have a calendar And then we don't got a 23 calendar yet. We need to get one and make sure that we put that date on our calendar and continue to educate and advocate individuals before that day comes around. I want to thank all of my panel members for such a great discussion and very willing to open up and talk about your settings and why this is so important and how we can work together to ensure that every person with a disability that receives home and community-based services is ready for March 17th when it comes around. I will now turn it over to Aaron Pringley, Policy Director for NACDD.
Thank you, Emmanuel, and all of our panelists. We are running a little ahead of time. So if anybody has a question, they should feel free to raise their hand in the chat, the participant room, or just type it in the chat box. I have a question for Kate. Kate, could you remind us what a person-centered plan is, and how do we know whether we have a person-centered plan, and who do we talk to?
Thanks, Erin. That's a great and important question. I'll also put the website for the National Center on Advancing Person-Centered Practices and Systems in the chat. But a person-centered plan in this context is the plan that you make with the people that you trust in your life, might be family, friends, neighbors, coworkers, for the kinds of supports that you're going to get in the year. And it should be a conversation about what you want your life to look like and what your goals are of your choosing. And so how to know the difference between a service plan and a person-centered plan is that somebody will have talked to you about who you are and what you want and what your interests are and what your strengths are and what needs you have. And as we mentioned, you will have had choices about disability specific and non-disability specific environments. And that planning process probably happens every year for most people, but it's a live thing, right? Our lives change, and it's something that you should be able to change throughout the year when you want to. And the person helping you write that plan should be really good at it. They should have lots of tools and ideas for how to help people think about their lives. I hope that answers the question, Erin.
Yes, thanks, Kate. And we have a couple of other comments. Liz, did you want to go ahead and go next?
Yes.
And then after Liz, we'll go with Nathaniel.
Thanks. I wanted to share a story about my services and my husband's services. And by the way, I was given permission to talk about that with my husband. So I want to make it real clear that I asked him about on the story as well. First, and this happened just within the last few months. Since May, we haven't had a DSP because of the DSP shortage, which is not my provider's fault. It's just another issue that is on the chopping block. And we need to work on that as well. But so my DSP quit, and they our provider found I needed someone to go shopping with me, not for food, for clothes. And that was all fine. And then I needed someone to help me go to mail something. And that's when I ran into this issue. The issue was that my husband and I wanted the DSP to come at a certain time, because we have a routine, we have a life to deal with, our own lives. We do things the way we want to deal with, and it's not up to the provider to tell me or my husband when we want our DSP to help. We're not there to fit into their schedule. They need to fit into our schedule. And this is about us. This isn't about families or the state. It's about us, meaning people with disabilities. We get services. It's like going to pick out the apple or the orange at the grocery store. Well, nobody says pick the pear. You pick what you want. So that's my story.
Thank you, Liz. And then Nathaniel put in the chat, I am on private insurance and was told that in order to keep my case manager, I was coerced into Medicaid. Why are people on private insurance excluded from getting the same services as people in Medicaid? Nathaniel, did you want to add anything to that?
Yes, my name's Nathaniel Geyer, and I am a research support technologist at Hershey Medical Center. I make over the threshold of Medicaid threshold that many of you are on. So I was excluded because of income, and I was coerced, even though I have private insurance, I was coerced into applying for Medicaid. I ultimately was rejected, fortunately, but I was coerced. And I was so embarrassed that I was coerced, and then I actually was dropped by the county because I wasn't on Medicaid. And that is something that gives me a big stick in the mud, being coerced into applying for something that I obviously don't need because I drive, I am a voter, I pay taxes, but yet I was coerced into public insurance. Private insurance does not have all the rights as people in public insurance, and I'm glad that I'm not on Medicaid. I have a different perspective about this rule. I think it's a good start, but it needs to include people in public and private insurance as well.
Kate, did you want to try to address that issue of why don't private insurance companies have to follow this rule?
Yes, that is a
Yeah,
big question.
Yeah, that's a good question. So before I try to answer that question, although I don't know all the answer, I want to point out that this rule and advocacy around the rights that people with disabilities have is something you can absolutely be involved in while not being a person who gets services, right? Like we all need allies. And so you can still care about it and speak up about how you think things should be, even though you're not a person getting services. The reason that someone might have said Medicaid is important is that Medicaid allows for what's called a Medicaid waiver. And the waiver—
Yeah, I'm familiar with that.
Yeah, so it's that option to waive the limitations that exist in private insurance and get the community-based services that a waiver allows. that is so unique to federally and state funded home and community based services. These things like help with getting dressed every day and maintaining your house and cooking meals and going to the grocery store. Like Liz said, those are things that regular health insurance, private regular health insurance, and regular Medicaid doesn't pay for. You can
I
only
know.
get those things. Yeah, so that's probably why.
Yes, but I don't have a concern about that. My concern is more or less the fact that the poverty threshold has not been rose in several years, and I make more
Mhm.
money than the poverty threshold allows, and that's very concerning to me that people have advocated for service things, but haven't actually rose in the poverty threshold.
No kidding. I could not agree with you more, and that is such an important advocacy area because some states, because this is up to states, some states have created higher income thresholds. Some states have created Medicaid buy-ins so that even if you earn a lot of money, you can purchase Medicaid. So there are solutions, but they are not available everywhere. So
Thank you
I
so
hear you completely. Thank you.
Thank you,
Thank you.
Nathan and Kate. And there is federal legislation to increase those income thresholds. It's going to take a lot more advocacy as well. The next person is Reed Eaton. Reed, would you like to ask a question or give a comment?
I'll do it towards the end, but I'll wait. But I'm going to continue listening on what's going on. Thank you.
And thank you, Reed. And I don't see any other questions. Did any of our panelists want to give any final remarks or share stories that you weren't able to share in your comments before we go to the workshop?
Yeah, I do. This is Liz. And I just would like to say, because I was part of a small group of people who were talking about this in the 2000s, early 2000s. I think it was like 2005 or 6 or 7. I'm not quite sure when. I keep on forgetting. But it was in the early 2000s, and we want it to be a rule so not that this is our life. I know we get services from our provider and our families, and even the state might have a say in our services, but whose services are they? It's my services or my husband's services. So yes, my family might have something to say about our services and what they how they look or what we want to use our DSP for, but at the end of the day, it's our decision. It's our decision. And I want to make that real clear to the audience that it's our decision. It's no one else's decision than us. So.
Thank you, Liz. And you always remind us nothing about us without us, right? That's what is the most important thing. And again, I don't see any other questions. Any of the other panelists have closing remarks or something they forgot to say?
I just wanted to add that I'm with the moving that I'm doing and the housing guide that I have. Sometimes it can be tough to make decisions, because, and this isn't necessarily because of a lack of protection in the way it's done, but so with the housing guide that I have, I've had trouble communicating with them, and they're further away. I met with my case manager this morning, and it just, since it's a newer thing, a newer area in this just well, I'm sorry, but it's a newer area, and so I've they're just, aside from the housing guide I currently have, there's only one other company I can switch to, and I don't really know much about them. So anyway, what I'm just trying to say is sometimes it's just there's just a lack of options in general, and that can be tough, especially when you only know so much about them. So it's just it's just like a little bit of playing around, I guess you'd say.
This is Liz, and can I also make one other point by telling a story that I probably forgot to tell? This happened probably, I'm guessing probably 7 or 8 years ago, and it was on a hot day, and or a warm day, I should say. And so the my provider my DSP came into our apartment. It was my husband and my apartment. It was not his apartment. And he said, "Oh, I'm hot." And he turned up the air conditioning. And without even asking my husband and I. And that wasn't fair. It like if we went into someone else's house and said, oh, I'm hot, you would yell at me. You would say that I'm rude. Well, I can't say that about him, because he gives me services, and sometimes I'm afraid to be rude to him because I worry that my services will disappear. Well, that's not right. You have a right to say to Jim, and I'm using Jim as a name because I don't want to use his real name. You can say to Jim, look, this is my house, and I don't want it to be cold. I want it, and if you don't like it, leave.
Liz, I think your stories are so important. And it just, we do have to go to the next section in just a minute, but Kate, I did want to ask you, following up on what Liz said. So yeah, how do you how is this rule going to help people who, are afraid of retaliation? A lot of the supports that are provided could be, help, very, very important help they can't, that they need in order to live their lives, and that maybe they're a little afraid to speak up. How is this rule supposed to help them be less afraid?
Yeah, and it is totally scary, Liz, and I've been in that exact situation, and it's infuriating, but also scary. So there are some ideas and some processes that states are supposed to put in place. And the big one is that every state will have a plan for how any person getting services can make a complaint and get a response and help solving that issue. And they are obligated to make sure that when you make that complaint, you can do so safely, or nothing bad can happen, and your services and needs are safe. Now, the truth is, states are still in the process of deciding how they're going to do that. So in the meantime, everybody getting services also has some kind of case manager or a support coordinator. And that job is always supposed to be, that person should always be on your side, and they should be a safe person to talk to. But we know that sometimes you don't know that person really well. I think I've had like 10 case managers in 2 years. So that's why it's so important that the state is going to come up with a plan. And it's also why it's so important that we have self-direction and that we have lots of choices of providers, like you were saying, Derek, right? Because if there's only one choice, and Liz, if you fire that guy that turns the AC on and there's nobody coming later, then you're stuck. So that's another reason we have to work on provider development. Oh, and yes, NDRN, of course, Liz. So everybody in their state has what's called a protection and advocacy organization. We'll put the link in the chat. And that organization is federally funded to help with violations of your rights. Is that anything you want to add, Liz?
No, you said it
Okay.
right.
Well, again, this is Erin. I want to thank all the panelists and participants for those great questions. We're going to move on to our workshop where everyone's going to have a chance to break into small groups. But first, let me introduce myself. My name is Erin Prangley. I am the Vice President for the National Association of Councils on Developmental Disabilities. And it's time to get to work on making our own plans to exercise our right to live the kind of lives we want to live, using the tools of this new settings rule and building off of the stories that we've heard today. So we're going to watch a very short video. It's about 5 minutes long. During the video, you're going to hear questions that you might want to think about. So if you have a pen or pencil or someone with you who could help you, jot down your answers to those questions or thoughts about those questions that could be helpful when we break out into small groups. So after the video, we will break into small groups and discuss ways that we can make changes to our services or other ways that we can support the lives of people with disabilities in our community. Thanks, everyone. See you in a couple minutes.
Your services should be all about you. If you receive services from a provider, organization, or staff, your services should be person-centered. This means your services should be based on your hopes, goals, and dreams. That is, what's important to you. You need to be happy with the services that you are getting. You should be the driving force behind your services. If you're not, you need to speak up. This video talks about what your services should do for you and some of the ways you can figure out what types of services you want. All people have rights. Some rights you have because you're human. Some rights you have because you live in this country. Some rights you have because you have a disability. And some rights you have because you receive services. Basically, you have the right to a lot of different rights. When it comes to your rights for your services, you have the right to be safe and healthy. You have the right to privacy. You have the right to dignity and respect. You have the right to choice, and many other rights. If trying to figure out which of your rights are respected, it may be helpful to think about these questions as examples. Do people listen when you speak up for yourself? Are you able to have personal space and alone time? Are you able to come and go in your home as you please? Are you able to have visitors where you live? If you answered no to any of these questions, it may be helpful to think about what changes should be made to your services so that your rights are respected. To fully exercise your rights, you need choices. Choice means that you can select the services and supports that you need and want. Examples of choices include who provides your services, where to live, where to work, what to do for fun, what friends to hang out with, what you want your future to look like, and many more. Your services should provide you with choices. If trying to figure out if you have choices, it may be helpful to think about these questions. Did you choose the services you receive and where they're provided? Did you choose who provides your services? Did you choose where you live? Did you choose who you live with? If you answered no to any of these questions, it may be helpful to think about what changes you would like to make to your services so that they allow you to make these and other choices. Independence means that you are in charge of making decisions about your life. For example, you should be able to choose what you do during the day. You should be able to choose where you go. And you should be able to choose who you interact with. If trying to figure out if you have independence, it may be helpful to think about these questions. Do you have a chance to make decisions about your life and what you want to do? Do you choose what you do for fun? Are you able to choose your own schedule? Do you choose how to spend your money? If you answered no to any of these questions, it may be helpful to think about what changes should be made so the services you receive promote your independence. You have the right to community integration. Access to the community means you are an included member of your neighborhood and community. For example, you should be able to participate in local activities and events, receive services in your community, run errands and go shopping, have a job in the community, and many more. If trying to figure out if you're integrated into your community, it may be helpful to think about these questions. Do you spend time in places where other people living in your community go? Do your service providers support you to do what you want to do in your community? Do you get to do as much as you want in your community? Can you be in the community when you want to? If you answered no to any of these questions, it may be helpful to think about what changes should be made so the services you receive provide the opportunities you want to access and be part of your community. Like I said before, your services should be all about you, your rights, your choices, your independence, and your community integration. If your rights are not about you and you're not happy with your services, you need to speak up. It's your right. Your organization should know what's important to you, and your services and supports should help you achieve your goals. If you're nervous about speaking up, you should talk to someone you trust about what you want and need. Another way to advocate for the services you want is by sharing your opinions with your case manager or support coordinator. Your ideas will help them make changes so your services are about what you want. If you feel that your rights aren't being respected, you should talk to the Human Rights Committee at your provider organization. In each state, there's also a disability rights protection and advocacy system, which can help people with disabilities with legal or advocacy support. Your services should be all about you. You have the right to make decisions about your services and speak up for yourself. As self-advocates say, nothing about us without us. This video was made by the IDD MLTSS workgroup. You can find more resources like this on our website, c-q-l.org/MLTSS. For more information about what we shared in this video, see HCBS Guide, Your Right to a Community Life, developed by the Boggs Center on Developmental Disabilities at Rutgers University.
So again, these services are all about you. This time we're going to break up into small groups, and we'll have probably about actually more time now than we had before. 15 minutes, I'd say. Delancey, can we do 15 minutes? So each room will have, so you'll see a button pop up on your screen assigning you to a room. Go ahead and click that button, and you'll get into a room, a small group, where there will be a leader to lead the discussion for you. This is your time to share how you want to make a plan. And so others can listen from you too. So go ahead and click that button. We'll let you know when time is up, and then we'll return to the main room for remarks. Thanks, everyone. See you soon. Thank you, everyone, for rejoining us. This is this has been a really wonderful workshop. Thank you for participating in your breakout rooms. I hope you found the conversation valuable, as I know I did. We probably could have talked for another 15 minutes. But as we begin to gather in the main room, there are just a couple of poll questions that we would like to ask you. So Delancey, if you wouldn't mind publishing the first poll question, and it should come up there. And the question is, well, it's a statement. This workshop helped me understand my right to receive support services better. So you can only pick one. You can say strongly agree, agree, or neutral. So go ahead and pick one. And then question 2 says, I am better prepared to work with my support team to create the life I want because of this workshop. And then once again, you can answer agree, strongly agree, neutral, or disagree. And this poll will help us to talk to our funders and government to tell us, what value we see in continuing programs like this. But also, if you have other feedback that you would like to give about the program, again, please include the technical feedback because that was a big problem today, and I apologize again for that. But if you have other things you'd like us to do in the future, please send me an email directly, and I will put my email in the chat box. And at this point, I'm going to turn it over to Kim Mushino for closing remarks. Kim?
Oh, thanks, Erin. And I just want to apologize up front for anybody who was in a breakout room and was speaking and got cut off. That wasn't your moderator's fault. It's just the time ran out. And on that point, we can keep this discussion going. If you want to email any of us, feel free. Also, while we were in the discussion groups, we did learn that some folks in my room at least could use some support, some advocacy. If you need some help in your self-advocacy for getting the services that you need, please feel free to reach out, as we said, to your DD council in your state, your local Autism Society affiliate, your Disability Rights Network, or other advocacy organizations that might be able to help you. You shouldn't have to feel like you have to do everything alone. So thank you, everybody, for joining this workshop. I hope that you found it valuable. And I want to thank Donna Meltzer, Kate Brady, Liz Weintraub, Derek Spahn, Emmanuel Jenkins, Erin Prangley, the Autism Society and the National Association for Councils on Developmental Disabilities for helping to put this workshop together today. We really appreciate everybody's participation. We have recorded the session, and we'll be sure to send out the recording so that others can re-listen to parts that they want to, or if they missed it, they can watch it. So please be sure to join us for this workshop, which we're planning to do annually with different themes and topics. Again, please feel free to reach out. Thank you and have a great rest of your day.